Hello everyone, now let us see how to search a CPT. In the current session, we will be discussing a question from digestive system. First of all, coming to the question, excision of parotid tumor or gland or both. That is the procedure. Excision of parotid tumor or gland. Once the patient was under general anesthesia successfully, Dr. White assisted by Dr. Green. Here, Dr. Green is the assistant surgeon. Dr. White is the physician and Dr. Green is the assistant surgeon. Dr. Green opened the area in which parotid gland is located. After inspecting the gland, the decision was made to excise the total gland because of the size of the tumor. With careful dissection and preservation of the facial nerve. Here, preservation of facial nerve has been done. The parotid gland was removed. The wound was cleaned and closed and the patient was brought to recovery in satisfactory condition. Report Dr. Green's services. Here we are reporting the assistant surgeon. Here you can see assisted by Dr. Green. So Dr. Green is the assistant surgeon. These are the following options. First of all, let us see what is parotidectomy. Parotid means related to parotid gland. Ectomy means surgical removal. A parotidectomy is surgical excision or removal of parotid gland. It is the major and the largest salivary gland. The procedure is typically performed due to neoplasm or tumors, which are the growths of rapidly and abnormally dividing cells. Neoplasm is nothing but abnormally dividing cells. Here you can see this is the location of the parotid gland. There are two parotid glands. This is the masseter muscle and this is the parotid gland. Now, there are types of parotidectomy. It depends upon the specific nerve to be dissected or not dissected and the amount of gland excised. First of all, coming to first type, it is extracapsular dissection. In extracapsular dissection, excision of the parotid tumor surrounded by some millimeters of healthy tissue without searching and exposing the main trunk of the facial nerve is done. In extracapsular dissection, some of the healthy tissue is also removed without exposing the facial nerve. The next type is superficial, that is near the surface, or lateral parotidectomy. Here, excising all the parts of the gland. Here, complete excising all the parts of the gland, superficial or lateral to the nerve. That is, partial excision of the gland is done. That are superficial or lateral to the facial nerve. The next is total parotidectomy. Here, total removal of deep part of the parotid gland is done, typically performed if the neoplasm is affecting deep part of the parotid gland. Surgeons try to remove the gland apart from the facial nerve, yet dissecting all branches of the facial nerve. In total parotidectomy, branches of the facial nerve are dissected and this method can be done using trans-cervical surgical procedure. The trans-cervical surgical procedure is less invasive procedure that involves cutting only a small incision in the neck. That is the term trans-cervical. Next, coming to radical parotidectomy. It is typically performed if malignant neoplasm is impinging on facial nerve. In case of radical parotidectomy, the facial nerve is also excised in addition to the parotid gland. These are some of the various types of parotidectomy. In the CPT book, if you search for parotid gland, under parotid gland you can find tumor. Under tumor, you can find excision. So the CPTs that we must refer are 42410 to 42426 because here excision of parotid gland is done in order to remove the tumor. If you go for excision, under the description of 42410, it indicates excision of parotid tumor or parotid gland, lateral lobe without nerve dissection. Under it you can find 42415, which is nothing but excision of parotid tumor or parotid gland, lateral lobe with dissection and preservation of facial nerve. And under it 42420, it indicates excision of parotid tumor or parotid gland, total with the dissection and preservation of facial nerve. In our case, total parotid gland and tumor are removed with the dissection and preservation. In our case, preservation of facial nerve is also done. So the correct CPT is 42420. Now coming to the ICD, it is a tumor of parotid gland. Tumor is not mentioned whether it is malignant or benign. So you need to go to table of neoplasms. Under table of neoplasms, you can find the heading: type of neoplasm, malignant primary, malignant secondary, cancer in situ, benign, uncertain behavior and unspecified behavior. And if you go for parotid gland, you can find here they did not mention which type of tumor. So you need to go for unspecified behavior or unspecified tumor. So under parotid gland, for unspecified, the code is D49.0. Again, you need to go to the tabular list. Under the tabular list, you can find D49 series. D49 is nothing but neoplasm of unspecified behavior. Under it, D49.0 indicates neoplasm of unspecified behavior of digestive system. So this is the correct ICD. Now let us see the question once again. Excision of parotid tumor or gland or both. Once the patient was under general anesthesia successfully, Dr. White, assisted by Dr. Green, opened the area in which the parotid gland is located. After inspecting the gland, the decision was made to excise the total gland. So here total parotidectomy is performed with the preservation of facial nerve. So the correct CPT is 42420 along with 80 modifier. Why are we employing 80 modifier? 80 modifier indicates assistant surgeon. Here we are reporting Dr. Green services. Dr. Green is the assistant surgeon and Dr. White is the main surgeon. So for Dr. Green, that is for assistant surgeon, we need to indicate 80 modifier. And the ICD is D49.0. So the correct option is B42420 along with 80 modifier and D49.0. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.